We must have no stigma, none, about wearing masks when we leave our homes and come near other people. Wearing simple face coverings is not about protecting ourselves. It is about protecting everyone we encounter. We need new routines, new rhythms, and new strategies for this new middle ground in between. It's the task of each family, each small business, each employer, and all levels of government to apply common sense and make this happen.
Senate Majority Leader Mitch McConnell speaking on the Senate floor yesterday. With new cases in COVID-19 surging nationwide, at least a dozen states and cities are now pulling back on reopening plans. In Florida, where daily case counts soared to new records over the weekend, the city of Jacksonville will now require face masks in any indoor public place where social distancing is not possible. The city is scheduled to host the Republican National Convention in August. Meanwhile, in South Florida, counties have closed their beaches for the 4th of July holiday weekend. In Tennessee, a state of emergency order has been extended after a record number of cases was recorded there yesterday. In Georgia, the governor there is expected to extend the state's pandemic restrictions another 2 weeks, which are due to expire tomorrow. In Kansas, the governor indicated she will sign an executive order requiring most residents to wear masks beginning on Friday. In New Jersey, Governor Phil Murphy says the state is putting off further reopening plans indefinitely. Meanwhile, New York Governor Andrew Cuomo says officials would make a decision on Wednesday on whether to proceed, how to proceed. Willie.
Meanwhile, Los Angeles County health officials are warning conditions there are now deteriorating rapidly as fears grow that there may not be enough hospital beds to accommodate patients. Yesterday alone, Los Angeles added just over 2,900 cases, hitting a new record. This as cases in the county surged past 100,000, with more than 3,300 deaths reported. Los Angeles Mayor Eric Garcetti says that with the alarming spread in about a week, L.A. could revert back to numbers reached at the height of the pandemic. This comes just weeks after the state began to reopen. The new date also prompted officials to close Los Angeles County beaches this 4th of July weekend. So far, San Diego County also moving to pause its reopening plans, announcing bars that do not serve food will shut down until August 1st at the very earliest. Joining us now, Dr. Vin Gupta. He's a pulmonologist who's treated critically ill coronavirus patients in Washington state. He's also an NBC News medical contributor. Dr. Gupta, good to see you as always. So Mika just read through all the states that are now rolling back their plans. Los Angeles County is rolling back its plans, closing the beaches. You've been on this show for about 3 months, warning of just this possibility that if states reopen too quickly, we might see exactly what we're seeing right now.
Good morning, Willie. You're 100% correct, and it's great to see these positive news events coming out of certain cities in Florida. Coming out of, I love what Governor Murphy's doing in New Jersey when it comes to walking back indoor dining, because that's where we need to head as a country. But truly, what we need here is we need a state by state approach, but we need a national approach. We have the Vice President and Kayleigh McEnany talking about federalism, talking about states being able to carve their own way. What we need here is a national strategy. We just can't have Jacksonville being on the limelight or Los Angeles County and Mayor Garcetti taking the lead here. We need a unified approach. Obviously, masks, and it's about mandating masks with fines if you aren't adhering to it. That's where we're at, Willie. The time for incremental, half-measured leadership is well over because ICUs are filling up, and that's the big risk here. We're seeing it in Houston. We're seeing it across Florida. We're seeing it in California now. We've seen it here in Eastern Washington. So there is no time here to be patient to see what happens. So that's the big issue here. And then I'm really concerned about what the vice president did over the weekend, presiding over the worst type of super spreader event one could possibly imagine, a choir event where people are singing. And we know singing is associated with expectorating more droplets from your mouth. Why he's doing this and why he continues to do this model bad behavior is beyond all of us and is beyond explanation.
It is astounding that tomorrow is July 1st, and you are still on this show pleading for a national strategy 4 months into this national crisis. What would you like to see from the federal government? This may be a futile effort, but we'll keep banging the drum. What would you like to see from the federal government right now in this moment as we're seeing these big spikes across not just the South, not just the Southwest, but in Los Angeles and San Diego as well?
Well, there's three things right now I would love to see the government do. Actually, four. And I'm going to start with the fourth. I was going to mention the last is we need Dr. Birx and Dr. Fauci to not have to deal with distractions and talk about the rising evidence that's coming out that affects us all. It affects every single one of us. There's new evidence suggesting that the virus lasts in certain individuals up to 24 days after infection. Right now, guidelines are still saying 14 days and you're good. I want to know what Dr. Fauci has to say. I know my colleagues do. So we need to actually talk about important evidence, not distractions. Number two, we need contact tracing. Now there's new evidence suggesting that 2% of individuals account for 20% of transmissions in these so-called super spreader events like the one that the vice president presided over this past weekend. How are we going to identify those super spreaders without contact tracing? There's no national strategy, unlike the UK, Germany, other countries that have successfully managed this crisis. They have a national strategy. Willie, number three, we need to just, I hate to say this, somebody that loves to go to indoor restaurants, we need to walk back indoor dining. 19 times higher transmission rates in indoor settings versus outdoor settings. I hate to say that, but we need to hold on it. There's too much evidence that restaurant dining indoors is dangerous. And then number four, I already said this, if we can permanently ban indoor smoking, we can temporarily ban the wearing or enforce the wearing of masks in public, and we need to do that.
I mean, it always seems a little difficult to look back and judge, but I have to ask, Doctor, had we been very clear on the leadership here with clear daily briefings from doctors continuing over the past month, would these states be in this situation of having to shut down again? Had people been clearly social distancing and clearly, with leadership doing it as well, required to wear masks?
Mika, it's an important question, and the answer to your question is no, we would not be, because look at what the curbs are in the EU, in Spain, in Italy. They did everything largely right, and they acted in unison. We have 50 different approaches here in the United States because the vice president and his press secretary believe in federalism. That's what they're citing right now, not we're going to have a surge on hospitals. People are dying in record numbers. We need a one approach. So yes, to your point, we already know there's reams of evidence suggesting that strong mitigation efforts work. And so if we had instituted that early on, yes, of course, lives would have been saved.
Doctor, there's been some reports just in the last few days that the virus might be mutating, and that even perhaps the mortality rates might be declining. Now, I don't know if that's just because the number of people being infected tends to be younger than it was at the beginning of this. What are you hearing on how the virus is changing, and what will that mean in terms of trying to get a vaccine that lasts?
What we're hearing is that while there is going to be genetic drift, mutations that are occurring, and we're seeing some evidence of different strains out there that we're detecting, that a vaccine candidate right now is likely to be broadly effective. And so that is the hope, because the nature of the way in which the vaccine is being developed, that it should be broadly effective against some minor variations in the genetic footprint of COVID-19, even if we suspect some changes, just like with flu. There sometimes are changes, but the vaccine, in most cases, in most good years, is generally effective. So I anticipate that, at least in the short term, those mutations should be of significance.
Dr. Gupta, there are a lot of parents watching this summer for indications from the CDC and others of what the fall might look like for their kids going back to school, because not just it has implications for the kids, but for childcare, jobs, and everything else. What are you looking at as you see the data, as you see the recommendations from the CDC about what the fall might look like? Schools, I know, may try at first to go back. Maybe they stagger days. Maybe it's a shortened school week, obviously with distancing and masks and everything that comes with these times. But I know it's only late June, but in a month or so, people are going to start thinking about what school looks like for their kids. How do you see it right now?
Well, it's such a good question. I know parents across the country are wrestling with it. I get asked all the time about children with asthmatics. How do you protect my child? Is the question we often get asked. And the key piece there is going to be testing, likely on-site testing, to make sure that we understand who is and who is not positive with a weekly cadence, likely, is what I'm hearing from certain school districts. LA County, for example, I've heard that they're thinking about instituting a broad scaling effort, potentially on a weekly cadence, which is an enormous lift, Willie. That's not something we're doing nationwide, much less in individual school districts. And then contact tracing. Of those that are positive, we have to keep them out. And so that's going to be that combination approach, but it's likely going to have to be pop-up clinics, on-site testing to keep schools healthy and safe with a staggered approach, as you said. Half the school coming in on a Monday, the other half on a Tuesday.
All right, Dr. Vin Gupta, thank you so much. Pretty chilling what you said about the fact that we didn't conduct leadership about mitigation and lives could have been saved. Once again, we're still here. Thank you very much for being on the show this morning and sending that message. Still ahead, congressional Democrats are raising the alarm about reports of Russian bounties on U.S. troops. Congresswoman and former CIA analyst Elissa Slotkin says something has been off about the relationship between President Trump and Vladimir Putin, and that Americans are quite literally paying in blood for Trump's pandering. Congresswoman Slotkin joins us ahead on Morning Joe. We're back in just a moment.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.